When it comes to giving birth to a baby, most women hope for a vaginal birth. But sometimes there's just no way around a C-section. Also, in very, very rare cases, a woman may already be in labor, but then all of a sudden there are complications which may result in an emergency C-section. And so obviously many women ask themselves, what would a C-section be like?
Right. So in this video, we are going to explain exactly what to expect in a C-section. We are going to discuss what happens during a C-section, how does Caesarean anesthesia work, where exactly does the doctor make the incision, and much more.
Yes, being informed about what to expect in a C-section can help reduce your anxiety.
Right.
And this is exactly what we want to achieve with this video. This is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher in Science Geek.
And we are here to help you and your baby naturally and science-based. So let's jump right into it. Alright, so first of all, what is a C-section? Well, a C-section is basically the surgical delivery of a baby, which requires the medical team to make two incisions. One into your abdomen and the other one into your uterus. And we are going to see later in this video what exactly that means. Yeah. And just that you know, about 1 in 3 babies is delivered by a C-section in the United States. Mm. So it's quite a lot. Yeah. But of course the number is different in every country, right?
Yes. Now, a C-section is not done in the labor ward. Instead, it will be done in an operating theatre like every other surgery.
Right.
So if you're having an emergency C-section, they are going to move you from the labor ward over to an operating theatre.
Yeah.
Looking around in the theatre, you're going to see lots of equipment, mostly on movable trolleys. You're going to see monitors to check your heart rate. You're going to see a cardiography that checks your baby's heart rate. There is going to be a baby resuscitation table with a heater to keep the baby warm. And of course, there are going to be tons of supplies like swabs and needles and sterile instruments like in every other theatre.
Yes, one thing that often surprises women is how many people are present during a C-section. At the labor ward, it's normally only a midwife, your birth partner and some staff who are ready to jump in if required, right? But a C-section requires lots of additional people. So here is a list of people that you can expect during a C-section.
Yeah. First of all, there is going to be an obstetrician who will be performing the operation and his or her assistant who is basically an assistant surgeon. Then there is going to be an anesthetist plus an assistant to help him or her out. There are also going to be 1 or 2 nurses who are assigned all kinds of tasks. For example, they may have to monitor your heart rate, they may have to pass instruments to the surgeon, and many more tasks.
Yes. Next, there is also going to be a midwife who will be taking care of your baby once your baby is delivered. And most of the times, there is also going to be a pediatrician who obviously has the task to check if your baby is well. Oh, and then it could be that there are also going to be students, but if you don't feel comfortable with that, you can ask them to leave.
Yeah. Now, these are the people that you can expect to be present during a C-section in most Western countries, like the US, Canada, and most European countries.
Right.
Just keep in mind that this may be different in your country. But when that's the case, we would rather expect less people to be present than more, because the space in an operating theatre is limited.
That's right. And then, of course, one more important person is going to be present. Your birth partner can stay with you and hold your hand, unless you have to undergo a general anesthesia, which can sometimes be required in case of an emergency C-section. And that's because in emergency C-sections, time is usually of essence because very often the baby is already in the birth canal. And so very often there is no time to insert an epidural, which is why they give you a general anesthetic.
Yeah.
And since you're going to be unconscious anyway, your partner will normally be asked to leave the room.
Yeah. And just that you know, normally doulas are not allowed in operating theatres.
Right.
It's a bit unfortunate because doulas can provide such a valuable service in terms of calming a woman. But it very much depends on the hospital policy. So you will have to check with the hospital.
Right. Okay. So the next step is then to prepare for the C-section. This means that first of all, you will be asked to remove all jewelry and probably also your makeup. Removing jewelry is important because the doctor is most likely going to use an instrument called diathermy. This is an electrosurgical device which is often used nowadays instead of a surgical scalpel to make incisions because it causes blood vessels to clot, which keeps bleeding at the minimum. And so any metal on your skin could act as a conductor of heat and cause burns, which is why you have to remove it, or if that's not possible, they are going to cover it with some tape.
Yeah. Removing your makeup, on the other hand, allows the medical team to assess your skin color, just in case you are becoming unwell during the procedure. And then once that is done, you will be asked to change into a hospital gown, unless, of course, you are already wearing one in case you come from the labor ward.
That's right. Next comes the anesthesia. And as already mentioned, in emergency C-sections, it may be required to have a general anesthesia, meaning that you will be unconscious. But normally you would have a local anesthesia which just numbs the lower part of your body so that you can stay awake during the procedure. This means that normally they would either use an epidural or a spinal block. If you have already an epidural in place at this point, then you obviously don't need another one. All you need then is a top-up of the anesthetic, which usually works really fast, like in a matter of few minutes only.
Yeah. And if you don't have one in place, the first step of administering the anesthetic is to insert an intravenous strip into your arm so that you are able to receive fluids during the procedure.
Right.
This is required to put the epidural or spinal block in place. So how do both work?
Well, let's start with the epidural because it's more common, right? An epidural is basically a very thin plastic tube called epidural catheter, which is inserted into your back. And then the anesthetic is injected through the tube directly into your spine. In order to insert the tube, you are going to sit and lean forward, or you're going to lie on your side when they insert the epidural. And please don't worry, they're going to numb the area first, where they then insert the epidural.
Once the area is numb, they are going to insert a needle which is required to insert the tube. And once the tube is in place so that the anesthetic can be administered, they are going to remove the needle. And again, don't worry, all you're gonna feel is a very brief stinging sensation and maybe some discomfort when the tube is positioned. Yeah. That's it. And then once positioned, it takes about 20 minutes or so for the anesthetic to take effect. But then you're no longer gonna feel anything at all in the lower part of your body.
Right. A spinal block, on the other hand, is inserted in the same way as an epidural. So you're gonna be in the same position, either sitting or lying, and again, they're gonna numb the area first where they insert the needle. And then, instead of inserting a tube, they're just gonna inject the anesthetic and then remove the needle. And that anesthetic works quite fast, so it normally only takes some 5 to 10 minutes for it to take effect.
Yes. Once they have administered the anesthetic, pain-wise, the worst part of the procedure itself is really over.
Yeah.
So it's really mainly that stinging sensation that you are going to feel when they numb the area on your back where they insert the needle.
Yeah, of course we know that many women are afraid of the thought of a needle going through their spine.
Right.
And some are also afraid that the anesthetic does not work properly. Yeah. But please let us reassure you that the medical team is going to make sure that the anesthetic works properly before they start the procedure, okay? Yeah. They're going to double and triple check that you don't feel anything. It's really a standard procedure. So please don't worry about this at all.
Yes. Okay, and then once you are pain-free, they are also going to insert a urinary catheter into your bladder, which will remain in there up to about 24 hours after the surgery. Not only to ensure that the bladder remains empty during the procedure, but they also want to avoid that you have to get up too often during the first 24 hours after the operation.
Yeah.
Don't worry, you're not gonna feel anything at all at this point.
That's right. And then all that is left to do is removing any pubic hair where they are gonna make the incision and covering your abdomen with sterile sheets. Right. And what they're also gonna do is they're gonna attach some sheets close to your head so that you don't see what's going on during surgery. That's it.
Yes. Okay, and then next comes the actual incision. So now the doctor is going to make 2 incisions. The first one into your abdomen and the second one into your uterus.
Yeah.
And there are 2 ways to do that. Either they are gonna make a horizontal incision right where your pubic hair ends, or they are gonna do it vertically, as you can see in this picture.
Now, nowadays, the preferred way to do it is the horizontal incision because the muscle in the lower part of the uterus heals better. Besides, scars in this area are less visible, right? And so that's really the preferred way. But there are occasions in which a vertical incision may be required, for example, in case of a premature baby who is less than 30 weeks of age.
Yes. Another reason could be that the baby is in a transverse position and the membranes have ruptured. Because then the doctor may not be able to rotate the baby so that the baby can be delivered through the incision in the lower part of the belly. Other reasons for vertical C-sections can be uterine fibroids. But your doctor is going to explain exactly why you are going to have the kind of incision they propose.
That's right. So the incision itself is normally about 20 centimeters or about 8 inches long, and it can either be straight, but in most cases it's going to be smile-shaped. So first incision into the abdomen and then another one into the lower part of the uterus if it is a horizontal incision. Otherwise it's going to be a vertical one into the upper part of your uterus.
Yes. Once they have opened up the uterus, they're going to rupture the membranes if they haven't done so already. The amniotic fluid will then be suctioned away before delivery. And then the doctor is going to insert a hand into the uterus for 2 reasons. First, to check the position of the baby, and second, to disengage the baby's head, given that the head is engaged in the pelvis. And by the way, if this is an emergency C-section, then another step that may be required at this point is that the assistant surgeon helps pushing the baby back up the birth canal so that the head can be delivered through the incision.
Right. Afterwards, the doctor is going to deliver the baby through the incision, which sometimes requires forceps. And as soon as they can see the baby's head, the nurse is going to suction any mucus or liquid from the baby's mouth and nose, which is normally when you can already hear your baby cry. And again, during the whole procedure, you're not gonna feel anything at all.
Yes. What happens next? Well, that depends a little bit on the team, but normally the baby will quickly be presented to the parents, and then oftentimes the midwife and the pediatrician take over, whose job is to check the well-being of the baby. Such as checking the baby's heart rate, the baby's breathing, clean the baby, etc. And then the baby will normally be handed back to the parents for cuddling and kisses. And I'm almost certain that 1 or 2 pictures are gonna be taken.
Now, in the meantime, as soon as the baby is delivered, the doctor is gonna inject the mother a drug to make the uterus contract in order to help deliver the placenta. The contraction causes the placenta to separate from the uterus, which is a process which also takes place at the end of a vaginal delivery, by the way. So this step is basically the same as during a vaginal delivery.
Yes. And once the placenta is removed, there is only 1 step left. The surgeon is going to clean the uterine cavity before they're going to stitch up both incisions. Obviously, the uterine incision comes first and then the abdominal one. And then the procedure is basically over.
Yes, so you see, the actual surgery itself does not take much time. In fact, the whole C-section may take an hour or so, but the actual delivery of the baby may only take some 10 minutes or so.
And then finally, what happens after a C-section? Well, first of all, you're probably gonna stay at the hospital for 3 to 4 days, depending on your case. You can eat and drink as soon as you feel like it. Also, you're going to be in close contact with your baby. The reason why we say this is because we have heard that some women fear that they won't be able to see their baby during the stay at the hospital. That is not gonna be the case, okay? In fact, the midwives are gonna encourage you to start breastfeeding.
And one thing they're also gonna encourage you to do is move around as soon as possible in order to avoid a thrombosis. And then all that is left for you to do is recover from the C-section. However, recovering from a C-section is such a big topic that we really have to deal with it in another video.
Yes. We really hope that this video helped you understand what to expect in a C-section. And most importantly, we hope that our video could take away at least some of your fears and worries, just in case that you too are being told that you need to have a C-section.
Yes, if this video did help you, we would be super grateful if you could leave us a like or even a comment in the comment section below. And for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.